Good morning, everyone. I thank the ADOLESCON 25 team for giving me this opportunity. I'll be speaking on the adolescent sleep and the relaxation techniques which are required. As Vaishali Madam was telling, the three most important things for adolescent good health is one is nutrition, second one is sleep, and third one is the exercise. And these three are the most neglected part in the adolescent health. The adolescent sleep needs are around 9 to 11 hours for the age group of 11 to 10 to 13 and 8 to 10 hours for the age group of 14 to 17. But according to one study, the Polari et al. In 223, 32% of the adolescents are getting less than 7 hours of sleep. And the physiological changes of sleep are because of the circadian rhythm change in adolescence, where the sleep time is postponed because of the delayed secretion of the melatonin, and the sleep drive, which with the homeostatic sleep drive, where the when the adolescent stays awake for a longer time, he tends to fall asleep at the earliest time. So that also is delayed in the adolescent period, and there is the behavioral changes which is occurring in the adolescence because there is an increased autonomy and the independence which offers a poor bedtime hygiene, and there is a inconsistent sleep schedules compared to the children below 10 years. And there are also the external pressures like academic demands, social pressures, which significantly interrupt the natural sleep wake rhythm in the adolescent period. So the adolescent sleep has got the NERM sleep stages, which progress from light sleep, deeper sleep, and the deep sleep, which is critical for physical restoration and growth. The growth hormone is being released in the slow wave period in the deep sleep period. Then the REM sleep is there, where the memory consolidation and learning is occurring. And usually there are 4 to 6 cycles have to happen for the adolescent for a better brain growth and better cognitive maturation. And whenever there is a depth, sleep depth, then there is going to cause lots of problem in mood, cognition, and overall health. So we all know what are the common barriers to healthy sleep. It may be technology use, where 70% of the adolescents use devices within 30 minutes before bedtime. There's a lot of academic pressure, especially in 9th and 10th standard, especially the NEET exam going. These students, IIT going students, they lose a lot of sleep just to get more marks and to get into the competition. And the parental enforcement is not there usually during this period, and lapses in bedtime enforcement contribute to irregular sleep patterns. And social jet lag, usually the week days and weekends are different. The weekdays when the school or college starts early, they have to get up early and there is a sleep loss. And during the weekends, they tend to compensate that, and that's not good for the circadian rhythm. And there may be environmental changes wherein a noisy environment, especially in the urban neighborhood or a very congested neighborhood, and there is no private space at home. When the environment within the house is very congested and there is no private space for the adolescent, he may not have time to sleep, have a private place to sleep. And the excess caffeine consumption which occurs with the energy drinks or with the coffee and tea, that can also interfere with the sleep of an adolescent. Sleep deprivation usually has found that 20 to 35% of the adolescents have memory reduction, cognitive dysfunction, and in 20 to 23% of the cases there are concentration decrease, there are ADHD like symptoms in a sleepless adolescent. There is a 3 times more of risk of mood swings, irritability, depression, and anxiety in adolescents. And especially those adolescents who drive, especially between 18 to 25 years, there is a fall asleep crashes which occur in 55% of the cases, especially in Western countries. And there are some sleep disorders in adolescents which we should be concerned as a pediatricians and adolescent pediatricians. Insomnia is difficulty in falling asleep or maintaining the sleep. It is linked to school stress or late night mobile use or late night social life. And delayed sleep phase syndrome is an exaggeration of this adolescent sleep phase, where there is a shift in the circadian rhythm, and this is very much seen in the urban teens. Obstructive sleep apnea is seen especially in the obese adolescents, where snoring and fatigue is there, and ADHD-like symptoms are often seen in the adolescents, and this is often underdiagnosed unless reported. Some of the other sleep disorders are like parasomnias, where undesirable experiences in sleep occur, like somnambulism and nightmares, which are frequently common in the early adolescent period. One more feature is the restless leg syndrome, where there is a powerful urge to move limbs because of the discomfort in the lower limbs. The exact cause is not known. It is thought to because of dopaminergic dysfunction because of the iron deficiency. In adolescents, we have to screen through the Bear screen or Epworth sleepiness scale or pediatric sleep questionnaire. Next. So base screening tool is the what are the bedtime issues. So whether there's a difficulty in falling asleep or is using lot of screens during the bedtime. Ask for excessive daytime sleepiness and awakening during the night. Ask him whether the adolescent is getting up in the night and whether the regularity and duration is maintained for the sleep. The time to sleep and getting up the sleep is maintained throughout the week. And also inquire about the snoring. The pediatric sleep questionnaire has got 22 items and it shows the obstructive sleep apnea prediction and whether it is going for moderate or severe. So there are some relaxation techniques we can increase the quality of the sleep. So there is a progressive muscular relaxation where muscle tension release pattern lowers the arousal. So this is by experimentation is known to reduce the sleep latency by 35%. And mindfulness, where the adolescent comes back to the present state and he is not hovering between the past and the future. That awareness and detachment from the intrusive thoughts. This also improves the total sleep time and reduces the awakening. And breathing exercises like pranayama or box breathing, where 4 seconds of inspiration, 7 seconds of withholding the breath and 8 seconds of respiring through the mouth can activate the parasympathetic system and help in a good quality of sleep. And there is another system known as Yoga Nidra, where there is a guided body scan technique which can help in the sleep, and guided imagery, where the mental visualization of calming scenarios like being in the beach or being in the forest, that can help to increase the parasympathetic drive in the adolescent. And there are certain digital applications are also available now, where CBT for insomnia applications like Sleepio can be used to help the adolescent to have relaxation and have better quality of sleep. So cognitive behavioral therapy for insomnia is the gold standard for non-pharmacological intervention, and as far as possible in adolescents we have to use the non-pharmacological methods. And in this CBTI we use cognitive restructuring, where identifying and challenging the unfulfilled thoughtful about the sleep, and you use the relaxation response training, sleep scheduling and stimulus control therapy. So we all pediatricians and adolescent pediatricians should stress on bedtime approach. This is the acronym. B stands for bed is for sleep only, and establish a routine in the adolescent. Use dim lighting and never use the light exposure before 1 hour of sleep. Take off before 30 minutes, and intake of caffeine should be avoided after 4 p.m. and mind and body calming with using the relaxation techniques as I elaborated, and exercise which is very, very important to increase the quality of the sleep. Thank you so much.